Yesterday, the world's most populous country, China, observed the Lunar New Year. But there wasn't much by way of celebration. The coronavirus outbreak is killing people. 15 Chinese cities are under lockdown. That's almost 57 million people with no access to the world except the internet. The death toll has risen to 81. Close to 3,000 people have been infected, and Beijing is bracing for a blow to its growth. Economy will be a casualty. In this report, we'll tell you how China and the rest of the world are dealing with this emergency, and we'll start from Wuhan. This is where it began, and this is what the city looks like now. The lockdown is evident. Most vehicles are off the roads, banned. The streets have gone quiet. 6,000 taxis have been assigned in several neighborhoods for emergencies. On the outskirts of the city, work is underway to build 2 hospitals. These are being designed to keep coronavirus patients. On your screens are images from the construction sites. Thousands of laborers are working on war footing. These 2 hospitals are expected to be ready before the 5th of February. Meanwhile, back in the city, Chinese troops, members of the People's Liberation Army, PLA, have joined the medical staff in efforts to contain the virus. A total of 450 PLA medical workers were flown to Wuhan on Friday. Thousands of police personnel have been stationed at the borders of the city. All highways remain blocked to prevent any sort of movement. And in a rather controversial statement, the mayor of Wuhan has accepted that the city's management of the outbreak was not good enough. He says China needs to improve its emergency management skills.
Facing a sudden virus outbreak, our continuous work wasn't performed well enough. I feel that our capability of dealing with the crisis needs to be improved. Just as President Xi proposed, we need to modernize our governing capability and system. One of the most important aspects of modernization of governing capabilities is to manage our resources properly. And we also need to improve our emergency management skills.
The Chinese regime is clearly facing an increasing pressure to prove its adequacy. It's a major test for President Xi Jinping, and today he sent the Chinese Prime Minister to take stock. Li Keqiang, the head of the government's coronavirus task force and the second most powerful man in China after Xi Jinping. He was seen inspecting medical facilities. Well, apart from releasing videos and managing the narrative, what other steps is the Chinese regime taking? The trade of wild animals, for one, has been banned for now. China's finance ministry has extended more than 60 billion yuan to help fight the outbreak. That's close to $9 billion. And China is trying to temporarily limit travel. The Lunar New Year holiday has been extended by 3 days. But this extended break, we can tell you, will hit the Chinese economy. The toll on travel has already become evident. Railway transport fell by more than 40% on Saturday. Passenger flights are down by roughly 42%, and transportation across the country has declined by 29%. Retail sales and tourism have also been hit. Most cities in China were quiet despite the Lunar New Year. What about the rest of the world? So far, the virus has spread to 5 continents. It hasn't reached South America and Africa yet. Look at how far it has spread, though. 8 cases in Hong Kong, 5 in Macau, 2 cases in South Korea. Japan, Taiwan, Singapore and Malaysia have reported 4 each. 1 case in Nepal, 8 in Thailand, 4 in Australia. The United States has reported 5 cases. And not far away, 1 case has been reported in Canada. And in Europe, France has confirmed the first case of the coronavirus. Thousands of people from these countries live in China. What are they doing to help them? Starting with the United States, the US government plans to evacuate all its citizens from China in chartered flights. Australia too is working on ways to repatriate its citizens from the city of Wuhan. So is Japan. It has already evacuated some of its nationals from the Hubei province. Coming to India now, officials confirm that no Indian citizens have been infected so far. There are people under observation in some cities, but no confirmed cases of the coronavirus in India. Now, what about Indian nationals in China? Last week, we told you a few Indian students were trapped in Wuhan. We reached out to them. Listen to their plea for help.
हमारी यही अपील है भारतीय सरकार से और सभी भारतीय नागरिकों से कि इसमें हमारा सहयोग करें और सभी लोगों को सुरक्षित भारत पहुंचाने का इंतजाम किया जाए।
पूरी वुहान सिटी बंद हो चुकी है। खाने का भी कोई चांसेस नहीं लग रहे। जो हम लोगों के पास स्टॉक था वो भी अब पूरा खत्म होने जा रहा है और यहाँ पे मार्केटें भी सब बंद हो चुकी है। एयरपोर्ट बंद है, रेलवे स्टेशन बंद है। सो हम लोग यहाँ से बाहर नहीं निकल सकते।
So what does India plan to do? The External Affairs Ministry has requested China to allow Indian nationals to leave the city of Wuhan. Last we checked, an Air India flight has been kept on standby for the evacuation. It is waiting for the final nod. What else is Delhi doing? The Cabinet Secretary held a meeting today, and here's what was decided. 19 Indian airports will be thermal screening travellers arriving from China. 5 states bordering Nepal have also been asked to screen travellers. Private doctors have been asked to alert authorities if they observe any symptoms of the virus. The All India Institute of Medical Sciences, AIIMS in Delhi, has prepared an isolation ward for possible patients. The Health Ministry has set up a 24/7 call centre under the National Centre for Disease Control. You can call this number on your screens and get any information about the mysterious virus. So far, a total of 137 flights and close to 30,000 passengers have been screened. No positive case has been reported, but samples of 12 passengers have been referred to the Pune Institute of Virology. The Wuhan virus is spreading, but the World Health Organization's decision to hold off declaring the outbreak a public health emergency is baffling. China has a responsibility, yes, to limit the spread of this outbreak, but global health officials in Geneva too need to take quick action. It's a story we'll track very closely for you.